Are we ready?
Here.
Plenty of seats.
Can we all rise to say the pledge? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All that thinness.
Before we progress, I'm going to take a personal point of privilege. Some of you have heard this. When I die, I'm going to be asking St. Peter to put me in the Guinness Book of World Records for having said the Pledge of Allegiance more times than anyone on the face of the earth.
I love that.
This is the third time I've said it today,
Oh,
and I still didn't remember the words. Okay.
Gonna go to the. You are an attorney after.
Out of order. I've got a couple of doctor jokes I can tell.
Chat with my dad on the way.
As you know, I'm the black sheep in the family. I come from a family of doctors,
Doctors, that's right.
so I've had to defend myself
That's it.
all these years.
Prepared.
And I think I've done pretty good. Next on the agenda, and you'll learn in a second why I've got this, are the minutes. Is there a motion to approve?
motion to approve?
And is there a second? It's been moved and seconded that we approve our minutes from the last meeting. All in favor indicate such by saying aye.
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 All opposed? The minutes are approved. Third on the agenda, we are to announce that the next meeting of the board is scheduled for February 6th. The good Lord willing and the creek don't rise, and a snowstorm doesn't come.
Yeah.
So get it in your book, February 6th. Number 4 is why I have the gavel. It's my pleasure every year at the January meeting to assist you in your organizational efforts, which means the appointment amongst your members of a chairperson and a vice chairperson. With that in mind, I'll hold on to the gavel and I'll entertain a motion for calendar year 2024 for the position of chairperson of the Porter County Board of Health. Do I have a nomination?
To make a motion for Dr. Buxom.
Are there any other nominations? Hearing none, I'll entertain a motion that the nominations be closed, and in so doing, you will be effectively electing our incumbent for another term as your leader. Is there a motion to close the nominations?
I move we close the nomination.
And is there a second?
I second.
All in favor indicate such by saying aye.
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 All opposed?
Thank you.
Well, you're welcome.
No,
Don't
good.
thank me.
It was
Thank you.
fun.
Thank you. It's been an honor and a pleasure, so I look forward to continuing on.
Okay, one more task and then I'll be quiet the rest of the night. And if you believe that, you,
Yes, gonna say,
I'm sorry. A vice chairperson. Do I have a nomination for the position of vice chairperson?
I nominate Dr. Fleming for vice chair.
okay.
Looks like he's willing to accept.
Yes,
I
have-
second that motion.
It's been moved and seconded. All right. Any other nominations? Hearing none, I'll entertain a motion that the nominations be closed with the realization that in so doing, Patrick will be elected our vice chairperson. Is there a motion to close the nominations?
I move we close the nomination.
And is there a second?
I second.
All in favor indicate such by saying aye.
Aye.
All opposed? We have a chairperson and a vice chairperson, and I'm going to hand the gavel back before it goes to my head. And we can proceed with old business.
Great. Any old business to attend to? With the absence of that, then we'll move forward to the report of our board attorney. Back to
Back
you.
up there.
Yeah.
At last month's meeting, you approved John's theory that we should use some of the grant money that we get from the state for emergency preparedness to have a deputy. And specifically, Jeff appeared before you and you approved that. With that in mind, I sat down with those two gentlemen and prepared a deputy emergency preparedness coordinator contract that I believe went out in your packet of material. I'll answer any questions anyone may have. Absent questions, the position is virtually identical scope of work-wise to what John does for us. They're just going to make sure that they have all the time covered because neither of these are full-time positions, and Jeff will be reporting to John, who in turn reports to Dr. Stamp and to our chairperson. Hearing no questions or concerns, Madam Chairperson, I'd ask that you entertain a motion to approve the agreement for a deputy emergency preparedness coordinator. This is one of those unique situations, and I'm the other unique situation. We work for you, for the board. You approve my contract, you approve John's, and the reason for that is I'm not an employee, I'm an independent contractor. Otherwise, people who work in the health department report to Dr. Stamp, who in turn reports to the board. So this is a little you won't be asked to do this often as approve a contract. So
If we can entertain a motion to approve the contract for our deputy emergency preparedness.
I'll make the motion to approve the contract.
Second.
Demetrius, if you can do a roll call.
Yes, Dr. Boxam,
Yes.
Dr. Brunt,
Yes.
Dr. Fleming,
Yes.
Robin,
Yes.
Kathy,
Yes.
Dr. Osan.
Yes.
Thank you.
Thank you for joining us. Thank you. All right, we move forward on to claims and receipts. I think that's been passed around.
Yes.
Did you?
And signed.
Are we good? Are we good? So if we can have a motion to approve our claims and receipts.
I move to approve the claims and receipts.
Thank you. A second?
Second.
Second?
All right, Dr. Boxam,
Yes.
Dr. Brunt,
Yes.
Dr. Fleming,
Yes.
Robin,
Yes.
Kathy,
Yes.
Dr. Osan.
Yes.
Thank you.
Thank you. And so we will move on to our reports of committees, staff, and health officer in your order of choosing.
Carrie's up first.
Okay.
Dr. Fleming, do you mind if I shag this?
No. you-
Sorry. Thank you. All right, I have lots of exciting news this evening. As we rolled into 2024 on January the 2nd, we did receive into our account the Health First Indiana funding as promised, which there was no doubt, but it's very exciting to see that come in. Chris got a call that there was some funding up here, and that is exactly what it is. So we are very excited to have received that. So along with that information, I just kind of wanted to share updates to our website, the State Health First Indiana website, what we've been up to so far, and then also go through the strategic plan that I believe that you all received in all of your information as well. See if you have any questions, kind of go over things that we had in our budget, categorized in ways in which we can take immediate action, partnerships that we'd like to enter into, that kind of thing, and see if anybody would like to propose action on those things at this time. So what we have, well, first of all, I want to introduce some people. So at our last meeting in December, as you know, that was Connie's last meeting. So Connie had been the director of nursing with the health department for 38 years, and her last day with us was the Friday after our last meeting. So the following Monday, we were able to announce to our staff that we had a new director of nursing, and that's Jessica Muller. Has been with us for 5 years with the health department as a public health nurse. She helped to blaze the trail. She's been our school nurse liaison since the beginning of that program, and she also has been very key in the beginning of our outreach, so that we are very happy to have her with us. So she's our new director of nursing. And then we were set to hire our grants and billing specialist, as we had talked about, the other new position in addition to the care coordinator. And we hired from within for that as well. So Chris Contrino is our new grants and contracts specialist. And that was effective January the 2nd. So we are currently accepting applications internally right now for office manager. And then we will let you guys know how all of that rolls out because that'll kind of be a trickling down process. And so that was our exciting news with staffing. And then we had some other part-time to full-time staffing that we'll discuss that was in the budget that was able to also take place on January the 2nd. So I just wanted to highlight some things from our website. We have been talking a lot about Carrie Honeycutt working on our branded Find Help. That is not what I wanted to go to. I'm so sorry, you guys. Please forgive me. The branded Find Help site, and she came in the very first day and started working on that, and we have a site that's up and running. This is the button that links to our Porter County's Find Help site, where we are able to brand that, we are able to put things in order of, you can contact this resource right here in your county. This is available 24 hours. We're able to put resources on there, whether they're free or sliding scale. There are certain resources that do have costs associated with them, but that is something that is still a resource for the county, and so we're kind of able to manage those things ourselves, and we are very excited to have this site up and running. We all have it in our signature line of our emails, and anyone is welcome to this. We are sharing the button far and wide. We hope to get this out onto all the trustee pages, hopefully municipality pages, the school pages. Anyone's welcome to borrow this for their email signature or any place else that you think that it would be a good place for people to have it, to know where they can click to find help. So this is help for food, for clothing, for any kind of, if it's a medical need that they need, if it's housing, if it's transportation, any of the resources that we know of are on here, and we're always happy to add to that and to expand that as well. So for our website, the plan is, and Demetrius is working on this right now, box right here into the Find Help button. And then our Contact Us button is going to go down onto this row, and then all of these icons will just scoot down, and this one will go away. So that's kind of what we're planning for our website as far as putting the Find Help on the Porter County Health Department's website. Does anybody have any questions about Find Help or any of those things? So oh yes.
Is it accessible via like phones, tablets, and things beyond computers?
As far as like if you were using a mobile app to access the internet, yes.
Okay.
Yes.
Because I know a lot of people don't have access to computers, and I want to make sure that they have access to the help button.
Yes, absolutely. And so that's why really we want to get it out there everywhere so that people recognize that button with our website and with being able to find help, and they know exactly what it is when they see it. And any other ideas anybody has for places that we should, contact for,
I was just also thinking, are there kiosks in places where people who don't have phones or tablets might be able to ask? I don't know if they're the idea
Library.
of kiosks.
That's a great idea for on the library, places where,
Libraries, other county buildings, just
Yeah.
other places where if people, their battery's dead, they weren't able to pay for their minutes on their phone, they don't have access to a computer, those folks, would still, as Porter County residents, have access to the help. So
that's a wonderful idea.
yeah,
And maybe some churches and
yeah,
things of that
anybody
nature.
that we might be able to.
Yeah, anywhere where they might go seeking things or where they might go seeking internet access to be right
Right,
on the
yeah.
front page. I see you writing. Wonderful. Thank you.
Yeah.
Thank you, guys. Does anybody else have anything? And if you think of anything later, please.
Well, on Facebook, they've got that Neighbors Helping Neighbors for Porter County. That probably would be a good site because they usually have like a tab where people can find food. I think there's like where they have the food banks and the shelters that are available locally. Exactly. Thank you. So maybe that would be a good place to.
Yeah.
So I don't know who the administrators are for that group off the top of.
Yeah, we can reach out and find out.
Yeah, I mean, that would probably be a good area to have a link for, because so many people go there asking
Absolutely.
for help
They do.
all the time. I mean, I just kind of like look at it on a regular basis about all the people that, are asking for,
Sure.
just food and immediate help and
Shelter.
exactly. And You know, they are just trying to get some basic needs met, and if they are available, that link's available, then that will just, you know, maybe
Yeah,
expedite some of the.
absolutely. That's a great idea.
Yeah.
It's a really good idea too, because on that site, they also, people in the comments will tend to try to refer people to
Correct.
places. And if they have links
Link,
in
yeah.
the find help button, then they're getting accurate information. So,
Yeah.
yeah.
Right.
that'd be
Yep.
Actually a really good idea.
Yeah,
And some people are actually helping people that don't have phones on that site.
Yes,
that's
Or
true.
just,
Yes, reaching out and asking for someone else. I have seen
Right.
that.
yes.
Or, you know, they're too afraid to do it themselves. You know, they,
Right.
you know, and they don't want to put their name out there, which I can understand in some sense too. So
Absolutely.
just a thought.
Yes. Thank you. Anything. If you guys think of anything later, feel free to email or call. So back on a website, sorry, that was a picture of it, so it was throwing me off. I want to click into the Health First Indiana tab. The state actually has a new Health First page as well, so I wanted to show that to you all. So this now links to the new state page. And this is the logo for Health First Indiana, and they also made a communications kit where we all have our own Health First Porter County logo, so you'll see that as well. So if you go, I am so sorry, my mouse, maybe I have it on the wrong side, I don't know. If you click into community info and select Porter County, this gives all of our information. So here it shows you what the amount was that we received on January the 2nd. That legacy amount that we've talked so much about that we received last year into our maintenance and trust funds, which were replaced by the local health fund. It shows what the county match will be for this year. And I just pulled that up for somebody yesterday, and I believe it was about 1.34 or something. And then it shows you next year, so the minimum and the minimum county match and the maximum we could receive and the maximum county match. And again, we assume it will probably be this minimum. We had 86 out of 92 counties opt in this year, and I believe next year it may even be 92 out of 92. And then, of course, it links to that scorecard, which was the same scorecard that was up here on the previous website.
And Carrie, that county match goes down by like $500,000, is that correct, next year?
Yes, so it goes to 20% of the total next year.
So those funds go back into the county then?
Yeah, and that's not they could opt to do more. You know, the encouragement would be to keep the levy, just to keep things so that you actually receive that increased funding. But of course, that's not an obligation or anything that we would be expecting. So we'll be planning for. And so that's that information from the state, and they have that information on every single county, if anybody was interested in that. And then if you go back to our page, sorry, it moved away from it. These other things that are on the page, aside from the strategic plan, are all things that we've had there all along. So this was our new press release. So it was published in the Times as is, and then there was an additional article in the Post on Monday morning. As we put things out for sub-granting or MOUs, those things will be linked here. Our job postings are all listed here, and all of those have been filled at this time. And then that whole public health needs assessment that we received the report on last month is there. So I just want to click up into the strategic plan. And again, like I said, I know that you all received this along with all the information that you received for the meeting this week. Does anybody have any questions about the plan? So for everyone else, there's just a recap of the Governor's Public Health Commission, Health First Indiana, what it means for Porter County, our scorecard, the different tools that the needs assessment utilized, as well as our data to come up with their information. This is pretty much what we heard about from the needs assessment last month. And then we go into all those core public health services. We're going to talk about the KPIs, whether or not we meet the KPIs, our opportunities, and then our possible partnerships. And that's present for each and every one of the core services. And again, this is on our website. So then it goes into our Health First Indiana plan. So here we just listed out all of the things that we can immediately do. And most of these were in the document that you received. We were still working on this. So we did list here the Child and Youth Health Fair that we already have planned for June the 14th. We are inviting a lot of partners. We're still in the process of that. I would hate to start listing people, although we will provide you with all of that, because I do not want to leave anyone out. But it's been flashing up on the screen, and Demetrius has listed up there. You know, we plan to do to offer sports physicals, to offer immunization clinics, to have all kinds of different community partners out there showing what not only displaying and advertising what they have to offer, but a lot of interactive things as well for families and children of all ages. So we're very excited about that. We have a lot of advertising planned for our partners and for us and all the initiatives that we are doing. So we're in the middle of getting all of that together. Some additional medical supplies to expand our mobile unit health clinic services. Some of these things were in here, the safe medicine disposal, jugs, language services, our sharps disposal we currently do, so we plan to really start promoting that. And some CPR training, that's additional on here from before. We have CPR mannequins, and John is currently certified to teach, but we want to make sure that we get some nurses certified as well and start offering some classes so that we can really offer those and promote that. And then we also have some partnerships that we would like to publish for public comments. And some future staffing expansion that we have recommended. And then also down at the bottom, we have listed the things that we have already done. So that includes the staffing that we've already mentioned. So the hiring of our care coordinator, our grants and contract specialist, and then those part-time to full-time positions that were implemented on January the 2nd.
Did you work through that wordsmithing?
We did. That was up in the, yes, up in the common repeating themes for the social and economic factors. So. Yeah. Thank you.
I just have to say, from when this all started and we started getting the KPIs, the folders full of what they are looking for us to attain, and how in this short amount of time that you have, it's January 9th, that you have created this for our county, addressing each KPI, having a plan, having things that are ready to enact immediately. I'm beside myself in pride with what you guys have accomplished. Honestly, this is.
I didn't want to. It's going to take me 3 days.
Yeah.
And the way you just organized it is fantastic. And it's just to see that progress sort of reignited the hope and motivation. This is something we need so bad.
Well, thank
So
you.
it's fantastic.
Thank you. And it was thanks to all of you and the wonderful staff. I mean, everybody,
I mean, you guys.
we all work together.
I mean, to have this all ready to go from day one is really commendable. I mean, it's miraculous, really.
Concise, and I like how you had some of the abbreviations. Because I do abbreviations all day, but this is
Yeah.
Just made it nice and easy for the knucklehead.
Thank you.
There we go. Very nice.
Well done.
Do we work with Dr. Rutherford at all? Because I spoke, looking at some of the areas that need help and guidance, and then I spoke to the family practice residents,
Yes.
Dr. Bates, and how we talked about that would be perfect.
So
to
that
get
specifically
locally
addresses the
trained
KPI,
guys.
right, of
Maternal child.
the maternal child infant
health.
mortality review and all of that. So we did invite Dr. Rutherford and met with her to, I mean, and she's
And she's
hit the
great
ground
position
running.
to
I'm
be
like,
in.
we're done. She's good. She's so, and she knows the resources to connect to. The residents, as you mentioned, they are more than willing to be involved in these processes. So we are so fortunate that we have these great people in our community.
Community outreach person's already spoken to them.
Yes.
Yeah.
Yes,
Yeah.
yeah,
Great.
yeah.
Our next resident actually starts next week. She will be here on Tuesday, the
Is
16th.
that the one that was at
so
one of the prior meetings?
we have,
2
the
months
two
ago?
that we've had before have been at prior meetings, and so then
That's
we'll
so
be getting our.
important to keep them involved, interested, because they'll be here from the beginning.
And what's
Hopefully they-
so great is that how willing,
I know.
I mean, when we spoke with Dr. Rutherford, the ideas we had, she had 5 more to add and contribute, and things that
Good.
she brought up with is just, we're truly blessed to have
That's-
this community involvement.
Just gives it good momentum.
Very.
So Carrie, my question was, for the things that are either partially met or not met, I know this is a working document that we are going to be adding things to.
Yes.
Ideas, ways to meet the KPIs.
Yes.
So I'm sure even for the ones that are already met, we might have additional things. right?
Mhm.
And
Yes.
so- Okay.
Yes.
But I really like even how you did the color.
Yeah.
Right? It really let me hone in on met, partially met, not met, the objective, because that's what we're looking for, right? Is objective, measurable data
Right.
that we can say, this is what we need to measure to look to see, is this actually being met?
Right.
So I mean, you all just did an amazing. It was
Yeah.
so easy to read, very, as you said, Patrick, very concise, thorough, and so I really appreciate that.
Thank you. And as we've talked before, right now, those KPIs that are listed are the state's KPIs. So right now, the state is measuring
Okay.
who has this program, how many counties do this, and in some cases, they're just looking for 90% of the counties
Right.
for. So by December the 31st of 2024, then we are required, and I apologize that you guys are having to watch me scroll. Actually, I'm going to go to page 14. Sorry, that'll be smarter. It's not. Oh, my number lock's not on.
40.
Please forgive me. Then we will be responsible for making our own county level KPIs. And so here's where, as we go through the year, we're gonna start saying, okay, what do we wanna measure? What are our goals? And this, like you said, will be a working document. And every time we update one of these, we'll republish the current PDF so that everybody knows what we're gonna be looking toward at all times.
I just enjoy it because our job is not to make and do, our job is to advise. And this just makes it easier for me and my profession, for the community. I look at it, okay, this is where I can be helpful. It just creates a nice platform.
Very.
As a doctor, I love to see it organized. It's like getting a textbook on Harrison's medicine versus the abbreviated version. I love it.
Please do not come look at my desk right now.
As long as you don't come and look at mine.
Everything we put in our pocket 5 years ago.
Yeah.
Still-
That was the best. Yes, it was. Me too. In my Palm Pilot.
And
Sorry,
annual,
yeah, see, I have the paper.
Yeah.
Probably have-
no.
Thank you.
Thank you. Thank you all. Does anybody have any other comments or questions or?
Do we need to entertain a motion to approve this planning to this point in the presentation of it? That's it? Does anyone want to entertain a motion to approve the planning that we've reached thus far and the plan going forward?
Motion to do so.
I second.
Okay. Dr. Bloxham,
Yes.
Dr. Brunt,
Yes.
Dr. Fleming,
Yes.
Robin,
Yes.
Kathy,
Yes.
Dr. Rosanna.
Yes.
Thank you.
Well done.
Okay, that's me, I guess. All right.
Yeah.
So I do want to applaud. Carrie has done so much work on this. It's been really good.
As have
I
you.
I have not done any of the formatting of this.
No, but you've contributed.
You would
Don't
not
sell
want to
your
have seen
short.
mine. It would have looked like it came right off a typewriter. But and also the way Carrie as administrator is working with our new employees and the division heads. They're all on board and contributing and working really well together as a team. I'm very pleased with the organization that we have currently working at the health department. Just they're doing a fantastic job. And with that, I think it is a good time for me to say this, that I think we're in a really good place now. That I am going to I'm announcing my intention to retire in 2024 from the health department. It has been my privilege to serve under the board for the past 12 plus years. It's been really an honor to work with an amazing group of people who are really interested in the health of the citizens of Porter County and in public health. So I don't have an end date attached to my intention to retire, but am excited to work with the board and with the commissioners and the council and whoever is then further involved in developing the job description for my position and getting somebody really invested in the health of Porter County onboarded. And I think it's a really great opportunity for somebody to pick up the ball and run with it and be able to kind of attach their vision to this planning for and implementation of the HFI funding. So again, I thank you for the opportunity you've given me to serve Porter County in this way, and I am looking forward to seeing where it goes.
I mentioned retirement to my wife. She said 20 years. Can I do that to you?
Maybe even half.
Can I give you some parameters?
Thank you.
She
Yeah.
said,
Gonna slow roll the end date.
keep you as long as we can.
Well, thank you.
Yeah,
Find help.
Find help and do.
I know. So maybe getting,
Find out.
but this is something.
Maybe this is your retirement.
Yes, that's right.
See?
But thinking about
By all your patience, really. Mhm. Yeah.
um, just those different ideas are things we could maybe integrate into the residency program, kind of facilitate this growing need. And I just remember in residency, I wasn't that involved with this. I was fixing the knee,
Right.
that stuff. So it's good to see that kind of direction. But
Yeah.
I like your ideas. I like your ideas. And creating
Thank you.
something for growth to make it a better option, more sought after option, because that's what we need, people to be interested and want to do it. And I thank you for getting us to this point.
Honestly,
My pleasure.
I thank you as well. I mean, this is a culmination of your efforts over the last few years to get us to this point, and I'm thrilled you're willing to stick around until we have a new
Yes.
plan going forward.
20 years.
I'm I have so much gratitude for what you've given this community and what you've taught myself and others about the public health of this community.
Inspired.
I remember when Dr. Babcock, her predecessor, was retiring, and we were really struggling trying to find a replacement. Very hard shoes to fill through all those years. And I was bemoaning the fact that we were having trouble, and he called me up one day and he said, "I've got your person, Maria Stamp." And you know what I said?
Who's that?
Who the hell is Maria Stamp? And have I learned who
Yeah.
she is?
Amen.
Incredible.
Incredible.
Thank you so much for giving of your time and your talent.
Yeah. Babcock today and asked him if he was interested.
Oh, there you go.
Yeah. No, got to go out for a bike ride. That's great.
Oh. Any other,
It is
any other reports?
Yeah, and enjoying it.
Any other reports? No, we're good. Any miscellaneous?
I was just curious, I know we were waiting for that report to come back. Are we planning any extra meetings for this year?
Well, I think that's open for discussion. I think where we're at is pretty good.
No, I do too.
Do you? Okay.
I just wasn't sure how everybody else felt, and if
Yes.
we were going to plan stuff, if we could
get it going.
Exactly.
I'm with
Nothing
you.
personal, but
Yeah.
you know, it's like,
No,
look at
the calendar fills
overwhelmed.
quickly.
Correct.
Yeah, I think if the need arises, then please reach out. If there's something, because she sent like before the holidays the list of items that they're hoping to attain, and then now having this with more concrete. I think we have a good system going forward in terms of the planning process. But I think we're all open to anything more. So if there's something
Maybe
that you
even like a
feel,
quarterly meeting might be beneficial.
I
Into the, our normal.
I think if the need, I don't want to make something
Right.
just for the
I'm
sake
not
of
saying,
something.
but-
No, I know. I'm all for any of it really, but I think if the need arises, or if we feel like there's gaps that aren't being addressed, or we all have our things that we were passionate about, and if we feel like those we want to have a special thing to discuss that or things like that. I think we could even do it in an email form if we want to have a small group of people to talk about. I've even thought about that, a group of people to talk about mental health or a group of people to talk about the preventative stuff, but as the need arises, I didn't want to force anything down anyone, but I think we're all open to that if the need arises. But honestly, I'm beyond impressed of the place that we're, like I said, it's January 9th and she sent this, on Friday, like that we're this far ahead of the game, I think is pretty impressive.
Right.
But I think we're, I'm definitely open to more, if we need to convene more to have certain discussions on certain topics.
Yeah, I didn't want anybody else, if they had a input on it.
I was just wondering about any, like you said, subcommittees with specific focus.
Yeah.
So like if we have a subcommittee that's developing the job description for the new, medical officer, or if we have a subcommittee to address maybe some of the partially met or not met, performance indicators. Not that, I don't want to be on 10 subcommittees, right? Nobody
Right.
does. But I think that those probably, if we have the energy to work extra, we need to focus it on the things that
We
need more
lack.
work,
Yeah.
right?
Right.
So,
So if you need us, then, on those things
Right.
that need more advisement, then I think we're all open to that.
Well, that was my question too, when we talk about some of the committees.
I know, yeah.
It's nice to see you do have already employees that are in charge of
Yeah.
working on. You've got those things moving and you have enough people supporting those community or committees that'll help with some of the partially fulfilled. You feel that
Since the beginning.
Yeah, and we've found a lot too, and this is one of the things, we've been very, Carrie has a huge wealth of knowledge as well as what's out there, and so as she's been getting things together, and we've been talking about the opportunity categories, and we'll start talking about things, and she already knows somebody that does that,
The
and so
resources.
there are
Yeah.
a lot of
That's-
things out there.
Untapped
in the
resources.
spirit of not duplicating
Right.
advertising, seeing how we can help them, that kind of thing. So there's really a lot out there. It's bringing it to light and partnering with them and just helping them do what they do, kind of thing. But absolutely, if there's anything specific that you guys see, or if we get to a place where we're like, okay, this is a gap, we know that we need this, then
Yeah,
is it?
you're asking where our job is to,
We can set something up.
like, to your point
Yeah.
is, hey, I have some ideas. Do you need that advice? That's what I was
Yeah.
thinking when looking at the partially or the ones. So, but you've always asked, so.
Yeah.
And you're open to receiving that advice. That's important.
Yeah,
So it's
anything,
nice.
ideas that you have in any of those areas, that's.
Yeah. It's good.
Anyone else? Any other miscellaneous comments? Okay, then at this time, I'll open the floor to public comment. No, you had the little blurb of what the public comment, don't make me read it.
They're passing on that opportunity.
No public comment. You're gonna let us cut loose early? Okay, then if we can have a motion to adjourn.
Done.
Wait, just for dramatic pause.
I didn't figure that.
At this point, can you please speak into the mic? We can barely hear you guys.
Oh.
Now I'm in the second row here. We cannot hear you at all.
I've never been called.
Especially Dr. Fleming.
Got it.
Sure,
I mean,
Sure.
absolutely.
That was my
Sure.
fault, 'cause I-
sure.
Yes.
I was trying to.
I feel like I'm proud.
Shot by the end of the day, too.
You know, we're not experts at this room. No, this is,
Earlier, so I'm like, hey, he did his job.
He does, and he tells me they're on too. He does.
I turned my mic towards me. It was going that way.
It was,
I really feel like I'm
it
yelling.
was trying.
Yeah, sure.
You're right.
Signed in, please.
Not used to that.
on, of course, she's my daughter, Robin's comment about going on, putting it on Neighbors Helping Neighbors or whatever it is.
Can't hear you.
Oh gosh. Anyway, and I would think, I don't know, done to put it on as many places that are not the Porter County website, okay? Because I don't know what young person or even regular citizens in Porter County ever go, except if they have to pay their taxes or something, to the Porter County website. I mean, I keep telling people about it. I mean, I'm like telling people all the time they need to come to the meetings because it's our civic duty, you know, to know what's going on and be involved. And they're like, oh, no, you're being political. I'm like, no, it's got nothing to do with politics, or at least it shouldn't. It's got to do with being involved and knowing what's going on and having, I mean, that's where the public comment can be helpful, okay? We don't all know everything, and we need each other. We really, really do. But anyway, I was thinking that if there's any way to get it out there so that, like if I've helped over the years a lot of young people. They have no clue how to get any help. And a lot of them that need help are not going to go to their parents, just letting you know. You know, I was always like the second parent, you know, like caring and would be reached out to. But if you could somehow figure out how to get Porter County, you know, help button, even I'll get this idea, the big buttons, you know, that you push or something, you know. But it'd be a good idea. All right, thanks.
Thank you.
Thank you.
Put it everywhere.
Yes.
Demetrius, are you able to put me back up?
Yes.
I'm sorry. I was looking, so we had a success story on Health First Indiana, and I could not find it when they redid the website. But the state just texted me, so I apologize, to tell me where it was at. So I wanted to share this. So on the
it was buried.
Indiana just before Health First website, there's a button called Public Health in Action, and when you go there, Porter County is listed first. They do success stories by region. And so this features the Zach Mago, the youth cardiac screening event that we did at Couch School in November. So I just kind of wanted to point that out. Doing more of those events is one of the partnerships that we really want to get involved with. So that is something that's open for people regularly. You know, when that's.
And I love the idea of the positive, you know, updates that people give.
Yeah.
Because that really encourages other people, you know, to look for help.
Yes.
Yeah.
You know, and
Yeah, totally. And I think people said they didn't know what the health department does, or they didn't know how to, and look at some of the things that we do. So I think this is, it's only helpful. It's amazing,
Yes.
actually.
And one thing I forgot to mention as well is Dr. Stamp had an idea today for us to feature our partners, which is something we work with Demetrius and Carrie on, start implementing is to, on our health, you know, website to feature our partner agencies, those that we're partnering with through Health First or anything that we're doing, so that we can promote what they're doing as well and kind of get everybody to be familiar with what everybody's out there doing. So, thank you.
Sorry.
That. Sorry. Thank you.
No, we wait.
Of course.
Okay, I'm like so disorganized here, you guys. I'm going to try this. I just wanted to mention tonight isn't going to be an organized thing, but I don't know. Along with the things that you guys do, I would like to see some more research being done on the different opinions that are out there among the doctors, and the new research that's coming out that the CDC and the FDA refuse to look at or talk about. I noticed that when Dr. Lopato from Florida, the Surgeon General, just called for a halt to the vaccine, I went and I looked at what was being talked about there, and he called for that halt after discussing with his Public Health Integrity Committee new harms or new concerns that have been coming up. And back in May, he contacted the CDC and Rachel Walensky, and she never even responded by the time he put this letter out, he finally just put the letter out. But in the meantime, there was new research. So why are they, I don't mean you guys, but why are they so afraid to look at new research? And then I went on the internet to find Dr. Lopato and his letter and everything. And one slam after another. It's like, Mr. Disinformation, he's a conspiracy theorist. What were they saying? Like, scientific nonsense. You know, this is a controversial figure. These are unevidenced claims. Show us that they're unevidenced, CDC and FDA. I mean, and he's using the FDA's published guidance from 2007 to bring this up, and he's asking questions which they're not answering. So I think among our county, it would be really nice to have more research going on so that we're thinking outside of the box and not just following just the CDC and the FDA. One thing that I'll end with this. The FDA's response said they're confident in the quality, safety, and effectiveness of the vaccine. Why? I mean, so then why not look at this information? What's the problem? They said they made a thorough assessment of the entire manufacturing process, and according to Pfizer inspectors that are now protected whistleblowers, that's not true. And we know that there's been a lot of harms. We know that just from VAERS that there's been a lot of injuries from this vaccine. So anyway, I just see too much conspiracy going on here, and we're just following one entity. Everybody just quotes the CDC and the FDA say this, the CDC and the FDA said that. Well, what if they're lying to us? I think they are, based on what I'm finding and from the doctors that are not allowed to speak on mainstream media. So I'd like to see more investigation into what other doctors are finding. So just wanted to mention that. Thanks, you guys.
Thank you.
To answer your question, 97% of scientists agree with whoever is funding them.
Well, that's another point.
I like to learn new stuff, and when we came here, we said the Pledge of Allegiance, and I've said the Pledge of Allegiance many times as well. And if you really stop and think about what's being said, each word, if you ask anybody, well, if you ask most people, what kind of country is America? Probably most people will say a democracy. A democracy is mob rule. It's basically two wolves and a chicken taking a vote asking what's for lunch. That's mob rule. And if you look at the Pledge of Allegiance, we are a republic. Why do most people say it's a democracy? And Benjamin Franklin said, it is a republic if you can keep it. Just something to think about.
Thank you.
Okay.
All right. So shall we have motion to adjourn? Second. Thank you.
This corner's.
We're done. Yeah. You guys. Thank you all.
All in favor,
All in-
stand up.
Yeah. Let's. Thanks so much. Thank you all.
All right, I need your
This is.
signature.
Yep.